has been just over a year since the first COVID-19 patient was identified here in South Africa. A year of pain for many of us, a year of uncertainty for all of us ahead. The first case was identified in KwaZulu-Natal. It's been an extremely and stressful, tough year, of course, for the healthcare workers. They've reflected on what it's been like battling COVID-19 on the front line. Here's my colleague Ayesha Ismail with that report.
The healthcare workers that I spoke to earlier today were saying to me that at the beginning they felt helpless and hopeless because they didn't really know how to deal with COVID-19 patients. They saw people getting really ill and many dying on a scale that they've not seen before. But as they gained more skills and knowledge, they went beyond the call of duty and often putting their own lives at risk to save others. They also talked about the camaraderie amongst healthcare workers in the private sector as well as in the public sector, and said that this really helped during very difficult times. But let's take a listen to what this doctor at Tygerberg Hospital had to say.
So a lot of us were working very long hours, seeing lots of patients. At the same time, our friends and families were also getting admitted to hospital. And, for me personally, it was a struggle to find beds for some of my family members while we, were on call.
The NEHAWA representative was saying that while things could have been done differently, they do also acknowledge that this is the first time that we've had to deal with a pandemic. And so they are very happy that the vaccines have finally arrived and that healthcare workers are being vaccinated. But they are also still appealing to South Africans to practice social distancing and to wear their masks while they wait for their turn to be vaccinated. Let's take a listen to this.
A very traumatic experience because we are from certain hospitals, workplaces, and you will see wherever you are. Today this person is working with you. I think the second nurse who retracted COVID. I think the whole ward was almost affected. 6 to 8 people were affected, and the very first nurse, she had us in tears how we were crying about her. It was a very traumatic experience. And I think up till now, because some of them were today here with you, tomorrow you're hearing they are in the ICU, and they never came back, they died. And some, like in instance, and I can say today we were like soldiers. We were in the front line facing this pandemic. It was a scary thing, no one knew how to treat it, and it was an exercise, you unsure about everything. And this person is dying today, and we kept asking ourselves, who is next? This is what we went through as healthcare workers.